like that. Let's look him all over head to toe. How is he doing with his feet? Is he chewing his feet like those itch him?
Yes, he is actually a lot.
Okay, because what we have around here a lot of times is allergies. You know, pollen allergy can make them itch all over like that, and then they chew their feet because they're walking through the grass. Okay. We'll also check him for fleas by combing him. Have you seen any fleas on him?
He did have fleas, and we've got him Advantage. My mom was just here.
Okay.
So he's been good at it.
Okay, good. That's good. Yeah, if you don't have to use it every day, that's certainly best.
Because,
okay.
You know, they're around each other.
Because the other thing he could be having there in that spot is a flea sensitivity. So he had the flea bite, and we'll see if he controlled the fleas. But if he's still having an allergic reaction to the saliva, sometimes we just have to give him something to break the itch cycle.
Okay. Now he just doesn't like them or what?
I don't see any fleas where we usually see them over the tail there, which is good. Hey, big guy, can I see your toes here? Let's take a look at him. Lift up your foot. With the allergies, now that would be more an allergy to pollen. You know, they get kind of red and sore in between his feet. Now you say he's chewing them. I don't see any sores there.
Yeah.
Did he have little bumps on his belly when you saw the fleas or not? Just that one patch, huh?
Yeah.
Okay, well, we're going to do a little skin scrape on there just to make sure he doesn't have any kind of mange, which isn't too common, but if we see that, that's a bug that lives under the skin, then we have to treat that differently.
Okay.
So I'm going to be right back. I'm just going to get a little blade and do a little scrape there, and then we'll know in just a few minutes, okay? If he's developing pollen allergy, what I want you to look for is if he's chewing his feet where it won't go away, getting really red, sore ears.
Okay.
They just kind of get itchy all over, and what we do is we do a blood test that looks for each tree, pollen. They can be allergic to people. They can be allergic to cats.
Okay.
Yeah, one of my dogs is allergic to me, so he had allergy vaccines. You see they have a shepherd right in here because shepherds are on the list of dogs that get allergies.
Pretty itchy all the time.
Yeah.
Like constantly itchy.
You know, is he okay with baths? Because giving him oatmeal shampoos can help.
He's on that earth bath oatmeal aloe shampoo.
Good. How often are you able to do it?
I'd probably give him one every month, every 2 months, just because I didn't want his skin to dry out.
If you're using like a hypoallergenic shampoo like that, when he's bad, you can actually bathe him every 7 to 14 days.
Oh, really? Because
it's the pollen sticking to him that causes the problem. It's like when kids get those vaccines, it's like you're kind of desensitizing them to what they're allergic to. Now, right now, he doesn't need that. You know, I only care what he's allergic to if I have to make an allergy vaccine. Okay. Plus, the cost of the test is about $200. So we only want to do that if we have to.
All right. And so his skin won't dry out too bad?
The only shampoos that really dry him out is if you're using flea shampoo or if you're using like a special tar and sulfur to dry him out. But if it's a hypoallergenic, like especially aloe oatmeal, that's made for that. Okay. And some dogs are bad enough that we really do them every week. Okay. If he would get crusty, which he's not right now, but actually crusty sores, then there's a different shampoo which I use, which is chlorhexidine, which is for bacterial infections. Okay. But he's only got the one spot right now. His feet actually aren't like fire engine red or sore.
And I'll notice, right?
You'll notice, yeah. And you can tell his ears too. This is kind of like, you know, his normal pink ear. Right. It would be like flaming red if he's having a reaction. So this isn't a food thing. You already have him on a good all-natural food, so we're not going to change that. But do you take any histamines yourself? Anything like Claritin or anything?
No, but I gave him Benadryl last year because he gets goopy eyes and runny nose.
And remember, you got to give him up to 1 milligram per pound. Right. So the problem with that is, you know, when he gets to this size, you have to give him 3 twice a day. So I'm going to get him just for this very short course here, one called Temerol P, which is a prescription antihistamine that has a very, very low dose of prednisone in it, just a little bit to break that itch cycle. I don't want him to be on prednisone long term because that's not good for him, but just to break the cycle is what we want to do. Okay. Most likely this is from a flea bite because it's not the pattern we see. The pattern with pollen allergy is flaming ears, really sore feet, underbelly, because they're laying and walking in the grass.
Well, that's
I didn't hear him come in today.
Yeah, well, we've started seeing a behavioralist to get him over wanting to eat children. Oh.